today. Healthy Horizons, if you don't know who we are, we're the first company to offer a comprehensive workplace mother's room services and lactation at work benefits at scale across North America. So we offer services for people at home as well as that working mother. In honor of Black Breastfeeding Week, we decided we wanted to put together a panel discussion, which is why we're here today, to talk about bias in the African American and Black community, and specifically how it pertains to breastfeeding. So we have put together an outstanding panel for you all today. The panel is inclusive of lactation experts as well as some corporate benefit, as well as a corporate benefit expert. So I'm going to give you a brief introduction and then we will go into our panel discussion. So our first panelist is Zakiya Williams. Zakiya, would you like to do a little wave really quickly? Zakiya is the Lactation Services Manager at the Lucille Packard Children's Hospital at Stanford and Palo Alto. She has a master's in public health and is an international board certified lactation consultant. Our next panelist is Carmen Lewis-Jones. Carmen, can we get a wave? Carmen is a nursing instructor at Prairie View A&M University down in Texas. She is a certified maternal newborn nurse and is also an international board certified lactation consultant. And our last panelist today is Janelle Bryant. Janelle is the benefits specialist at Yelp and has over 12 years experience working specifically in the corporate benefits field. So we all thank you and we welcome you for joining our panel today. And what I'm going to do is I'm going to go ahead and start some of the questions in the discussions. Again, if you have any questions, feel free to use the chat part of this group, and then I'm also going to leave a couple of minutes at the end of the discussion so that we can have questions. So the first question today that I'm going to pose to our panelists is, why should women, specifically African American women, consider breastfeeding, and what are some of the benefits? Zakiya, do you want to go first?
Sure. So again, my name is Zakiya. We think about the benefits of breastfeeding, probably most of us can kind of start splitting them, right? Like improved immune system, decreased risk of ovarian cancer and uterine cancer, helps, babies' overall gut health. We know the benefits, right? But specifically for the African American population, for me, what I see it as is a protective factor. It kind of helps to start women at the same playing field, right? We know that we have a lot of factors that can negatively impact American women and people in general. So this is kind of what I consider is like the first part where we're kind of all starting playing field.
I would agree with you, Zakiya. I just also like to add that specifically for African American mothers and babies, the bonding component is really special. We facilitate that bonding and that ownership of taking care of our children. Not only that, but like you said, it's protective. And, African American women die at a disproportionate rate after birth. And so the protective factor of breastfeeding and helping slow bleeding is very, very important as well. In addition to protecting babies for future conditions such as diabetes, asthma, and obesity. Those are also great benefits of breastfeeding as well.
So how would you all say that breastfeeding is actually viewed in the African American community currently, and then what can we do to help change any of these views or provide more information? Carmen?
Okay, sure. I'll take that question. No worries. I think currently, this generation of mothers, breastfeeding is viewed positively. I think we've had a lot of good public health campaign initiatives that have highlighted the impact and the benefits of breastfeeding. So a lot of mothers are interested in breastfeeding. I think one of the challenges with breastfeeding in African American women is that support to get from other family members or even grandmothers or great grandmothers or other support systems might have been not as accepted previously. And so I think for the current generation, though, breastfeeding is viewed very well among both men and women in the breastfeeding community.
Janelle, how do you see that in the corporate setting? Is there any differences that you have noticed over the course of the last couple of years?
As the years go by, I think it gets more common, more acceptable. You know, you see mothers out in public, so I think it's not technically frowned upon, but I think it's becoming more accepted. And because we have so many places to go to seek resources, such as like a panel such as this, even like Facebook or things, you can go and get the resources that you need, or just to have a conversation with somebody you can relate to that can kind of like, pretty much explain to you like, hey, there's nothing wrong with breastfeeding, and give you all the benefits. I kind of think that's, and it comes back to when they come to work, they feel a little bit more comfortable, especially with us having places for them to go and pump.
And from a corporate perspective, do you see that there has to be a difference in how you talk to the African American woman versus any of the other ethnicities that work specifically at Yelp or anywhere else?
What I would say is that I've noticed an increase in African American women, especially here at Yelp, because the other companies I worked for didn't have a room like Healthy Horizons, and it gives you that room where you can go to and be comfortable. Healthy Horizons provide everything that you need in the room. So before, you have to be able, you got to make sure you can keep up with buying the bags and have your breast pump available. Taking that to and from home is kind of an inconvenience, and with that all being there at the job, it's made it a lot easier for a lot of people who normally wouldn't do it. And it's more so the people in the African American community to come and feel comfortable with actually pumping at work now. So I've seen a lot of ladies at Yelp who are, like I said, in the African American community respond better.
And Zakiya, have you any thought or comment on this?
Yeah, I feel like there are, like any other population, you have people who have strong opinions. Whether some folks, like exactly what Carmen was saying, where younger generations are kind of coming in, like it's seen as the norm, just based off of kind of it being something that we're talking about that is visible to them, where some other older populations or other populations, they came from a different period of time where formula was seen as like a status symbol, and breastfeeding was seen as something that was, that's what other people do because of WIC was providing it. So, there's kind of been this switch historically of like formula being seen as like the gold standard so that you can go back to work. And this is across populations, where now it's more visible that like breastfeeding is, kind of gold standard. So it's been a shift.
Okay. And so one of the things I think that both Carmen and Zakiya, you both just referenced, what are some of the misnomers in the African American community around breastfeeding? And as lactation consultants, how have you all worked to specifically address that?
Zakiya, you want to start? Okay.
So I think, I don't know if it's misnomers I guess there's two things, right? Like there's misnomers within the Black community, generally speaking, around lactation and kind of how it's seen and are people aware of the benefits. But I think more so it's, as in lactation at least, it's the issue of people think they have these thoughts around like, oh, Black women don't breastfeed, so I'm not going to give them the same level of care, which has been my experience. Even from, I remember my very first day of lactation training, and my preceptor said, oh, she's Black, she's not going to breastfeed, so don't waste too much time in her room. So I don't know that it's twofold, right? Like there are one part of it where it's like, all right, people may not be on board but they not receive that information, like where if they would have gotten that, they have felt differently. So, I think a lot of times it's other people's perception where it's like, oh, well, Black women don't breastfeed, and that's just not true.
Yeah, I would agree. I would also like to add to that. Another one is that if you're not strictly breastfeeding, then a lot of women feel like they're not breastfeeding. It's like an all or none mentality. And so just encouraging women that some breastfeeding is good. Any amount of breast milk breast milk is a good amount of breast milk. And so helping women understand that I don't have to be strictly breastfeeding to feel like I'm doing the best for my baby.
And any specific things or ideas that you all have done to help just increase and help these women understand that, like Carmen, like you just said, any amount of breastfeeding is good. It doesn't have to be all or none. Anything that any of you all have done to specifically help that?
So at Stanford, we have a very small number of African American patients. Prior to, and I was just talking about that yesterday, like of the lack of diversity, I guess, generally in the Bay Area. I'm from New York originally and work with maternity facilities in New York City where we had a ton of diversity. And I think, and what people across the country, across the world find is that like people don't live in a bubble. So anytime we're working on these large public health initiatives or initiatives in the hospital, it's not just focused on the parents, mother, birthing partner, who, what have you. It's really about focusing on the family education. And that's, you know, particularly in the hospital, if you're trying to kind of do all of this teaching, then sometimes it's too late, versus having these conversations prenatally are super helpful, and involving the other parents, grandparents, people who are close to them. That is particularly helpful when we're trying to increase breastfeeding rates, in my opinion, and what I found to be super helpful.
Same thing as we teach nursing students. One of the things we focus on is, of course, the family-centered care and involving the family, specifically the birth partner or the father, and having them to be an encourager for the mom. Because like Zakiya said, in the hospital, there's so much going on that the teaching that's provided, even though it's very good teaching, may go in one ear and out the other. But the family members of the support system are going to be the ones to reinforce that when they go home. So focusing on directing education toward the family members as well.
And just to piggyback off of that, just a personal experience. When I had my son 3 years ago, I recall the lactation nurse coming in and she telling me how to do it successfully. But like you said, it went one ear and out the other. And by the time I got home, I felt like I didn't have the education that I needed to be successful. And then 2.5 months later, here I am completely bottle feeding. It was breast milk, but it was completely bottle feeding, and I felt like I just failed. So now when I do talk to other women, I just say, hey, we have resources, you know, look into it, investigate it, don't give up. You know, it's never too late. So with this time around, I'm 8 months pregnant. So this time around, I've done a lot of research to make sure that this go around is successful. So definitely that educational piece and the resources around us is beneficial.
Good. And also like resources on the other side, right? So a lot of times, again, particularly in lactation, you know, there's not a lot of diversity within IBCLCs as well. So it's not always something where people feel comfortable going to, say, an all-white support group. They might not feel like that's a safe space for them. Same with me at conferences. I don't always feel like it's a safe space for me. So, you know, making sure that we have like our chocolate milk cafes and things like that, where we can provide these spaces in which women can come together, people can come together and, you know, be able to work through some of those issues and get the support that they need.
Okay. And one of the other big factors right now in the African American community is just the disparity in healthcare in general. So as you look at the disparity of healthcare, what can we do, just as all of us in this field, what can we do to help the disparity, the conversations, and then how can we help that translate to helping to educate or inform the mother about breastfeeding and the benefits and, you know, everything around that?
I would say to start with a conversation. You know, if you are thinking about breastfeeding, talk to your friends about it, and you'll find that a lot of your peer groups have participated in breastfeeding or know someone who has. And so just getting that conversation started, I think, will be a beginning.
And as practitioners, excuse me, as practitioners, I think we need to be mindful of what implicit bias we may carry that can then affect the care we're providing. You know, there's a lot going on in the country right now, in the world right now. And I think people are starting to look inward at kind of what have I done or what have I been doing that may translate into these disparities. They don't just happen. And we know that a main factor when we hold things constant, racism is something that is affecting these inequities and these disparities. So, you know, for just as a field, if we can kind of look inward and see, like, what are my thoughts? What are my biases? What can I do? Is there something I can read? Is something, and not going to your Black colleagues and burdening them with that all the time, but really looking to see how can I do more learning and internal work to support the communities that I serve, particularly Black communities who, rightfully so, are on edge right now just because of what's going on in the world, research and studies that are coming out now, but have been here for years. This is not a new thing. This is just something that they're now highlighting because people are tired of, you know, the problem. Like, we have to do something to fix it. We can't just keep talking about it.
Yeah, and making available consultants who look like the patients that they're treating is going to be very important. I know, as Zakiya and I both, as IBCLCs, know that there are few African American or women of color who are lactation consultants here in the United States. I think there are more than 18,000, but I don't have a number of how many are African American, but I'm sure it's a small number. However, there are a lot of peer counselors who are great supports. A lot of them work with WIC. There are also certified lactation counselors who go through different programs, like I think the Healthy Breastfeeding Project is one that provides certification for those. So just making available those other people to help your clients are going to be helpful that look like them, because I'll tell you, a Black woman may not feel comfortable showing her breast to a white woman because we just don't know how you're going to view my breast, right? Or we don't know if you're going to care for me like my people will. I may not feel comfortable talking to you. And so that is definitely going to help minimize the disparity.
And I think one of the things that's come out of this is that, you know, there are resource paths, there's resources, but how do people go about actually finding these resources? You know, there's resources for hospitals, there's resources for corporations. And I know you all mentioned, you know, talking to your friends, but if your friends are in the same channel as you and they don't have that experience, then you're just going to be in this like cycle. So how can people go about finding these resources, these platforms, these groups to actually help them?
I feel like there's not really a directory per se of like, hi, I'm a lactation consultant, or like, unless you search for like a chocolate milk cafe, for example. But I think the onus is on the people who have the resources. So if Stanford has a support group and outpatient consults and an advice line and things like that, I need to make sure that I'm doing marketing not just in one specific population or in one specific place. Like, I need to be broad in my marketing to make sure that we are making ourselves visible to everyone who may need services. So, you know, I know that people come together, like I'm in a lot of lactation consultants of colors, birth workers of colors, Facebook groups. So I need to make sure that's where I'm promoting my things and making sure that they can kind of spread that information through their networks. So making sure that you're strategic in what you're doing and not just doing kind of this, what we've always done, which is just like posted on our website. That's not helpful.
Right.
And even for the corporate world, you kind of have a group. It's a small community, and so we talk through things like this, such as how can we make it easier for our employees of all nationalities, but even more so for the ones that we recognize don't. You can tell when someone comes back from work and you like, I know that person just had a baby and they haven't used the lactation room at all. So we try to put those resources out. We try to send out emails quarterly or as frequently as we get them. And I learned this because of just talking to my other peers from other corporations. So I see that a lot of them are doing those type of things, trying to keep our new mothers or breastfeeding mothers, doesn't matter because you know you can breastfeed for a couple of years. We try to keep them engaged and let them know that, hey, this room is here for you guys. We have the resources. We provide links if they have questions or concerns. So we try to be that additional resource at work.
And is there anything, you know, that helps? So on this call right now, I know we have some of the vendors, people that actually make product that for that breastfeeding mom. And then there's, you know, the services like Healthy Horizons. What specifically would you all say we could do to help, you know, mitigate the bias that's going on, as well as, you know, encourage breastfeeding in all diverse populations, not just specific to what everybody's always thought. What can we do to help?
I mean, I know sorry. One thing that is super important to me is making sure that we are not always having the same group of people in our marketing. So for larger, I see people from larger companies with Healthy Horizons. I don't want to see only white women on all of our information or white babies on all of our things. Like, I don't want to always see, someone who always presents as a woman, where we may have transgender folks as well who are giving birth and are breastfeeding or chest feeding. Like, even using the word mother, I try to be mindful of switching that up as well, so that way we are inclusive of all groups. So really diversifying your marketing, because it can be ostracizing to some people where they're like, I don't know that I'll be accepted with this group, or I don't know if like this company is not representative of me. So not pandering to people, but like just making sure that everything you do is really inclusive, and like diversity is, and kind of highlighting that is also very important if you are trying to bring someone into your organization or to your company.
And
Yeah, I would say too, reaching out and making yourself visible at different conferences. I know in nursing and a lot of other professions, there are all types of conferences and there are vendor halls. And so just making yourself visible in those areas, especially in corporate meetings or corporate conferences, there are mothers in those settings who are breastfeeding. And so that would be a great way to reach out to them. And I would not even neglect college campuses. College campuses always have people who are out in the hallways or in the quad or whatever, and those moms are having those students are having babies too, and so we don't want to neglect our young parents as well.
I was going to say, for Healthy Horizons perspective, that if we had a panel like this every so often, this would help engage our employees as well. It's something new, but once they see it repetitively, we can get that conversation going, and they may want to chime in here and there and learn new things. I think this is a great start, something that can be great in the future.
Okay. So if we talk about breastfeeding specifically, and we can look at this, in a silo specifically for African American, and then just for people that breastfeed or chest feed in general. What are some issues that they encounter? How can we address them? What are some suggestions that you just think should be at the front of mind for people as we're talking about breastfeeding? And Zakiya, like you just said, chest feeding too, so that we can make sure that we're being inclusive.
And sorry, can you clarify the question? Because I think
what are some issues that people encounter just in general, around breastfeeding or chest feeding? What are issues, and what ideas do you have they can, how do you coach them or encourage them to get past whatever it is, whether it's mastitis or things like that? What are some of the things that they might encounter?
So I think it's about meeting people where they are, with any kind of counseling, whatever the issue is, being respectful of kind of what they need at that time. I know sometimes, at least in the hospital, we're trying to give them so much at once, and it's like, they're not asking that right now. They don't want that right now. What they specifically asked you is about, the sore nipples, but they don't need the physiology of milk production. Like, that's what they're talking about. And this is with any group, is just like, take what do they want, not what you would like to give them, because that they're not listening to. They want what they've asked for. So just being mindful of that, specifically in the African American community, like just thinking about kind of things that may be important, like with mastitis. I'm just thinking of mastitis, like that may present differently if you have darker skin tone, like, but you're saying, oh, it's going to be really red. Okay, well, how else do we identify mastitis? Like being mindful of those things as well, based off of the population you're serving, and then also making sure that you're being culturally sensitive. So there may be some populations who don't always feel comfortable with having their breasts exposed, but you're like, no, it's fine. Asking permission before you touch someone. You would think that that's so, like, of course, but that doesn't always happen either. So just being respectful and being mindful and kind of, again, meeting people where they are.
I would also say a lot of moms are reluctant to seek help, and this is just not for African American moms. It's for new moms, all moms, right? We don't want to look like we don't know what we're doing, and so that follow-up call a week later, 3 days later is going to be very important, because we know that first week is going to be really important for establishing breastfeeding. And so if you call and offer your assistance or say, hey, I'm just checking on you, I'm here, here's my number to call me back if you need me, that's going to be important, because I guarantee you in that stack of discharge papers, they're not going to look through there to find that number that you gave them on that pamphlet. So definitely making sure you reach out in a timely manner.
And how does, is there a financial disparity in the level of service that women get, and or how much money they feel that they can apply to breastfeeding, into lactation consultations? And if so, how do you overcome that with a population that might not have as much of a disposable income, or realize how integral in that this is that they need?
So generally with, so I won't say that there's necessarily always a racial barrier, financial barrier. I'm going to want to make sure that I differentiate those between just income. So for people, let's say, with WIC, or people who qualify for WIC, they tend to have more resources through WIC, Medi-Cal, like they're able to get pumps more easily, things like that. I feel like there's this, then you have wealthy, particularly in the Bay Area. Money is different here, just generally speaking. And so you have these people who have like this really great insurance, they can pay out of pocket. And then you have this kind of space in between, where people don't quite qualify for WIC, but then there's a barrier in cost with lactation services. And depending on where you are, a consult can range from, let's say, $100 to $400 in the Bay. So, this makes things very inaccessible. So we talk about wanting to support people and making sure everyone has resources, and there's not always something available if you fall in that middle piece. So at least for a hospital system, like I try to make sure that we're providing free resources. If Stanford's paying for it, I like to make sure that that is accessible to everyone, regardless of income. Can we bill insurance rather than collecting money up front? That's what we plan on doing with our outpatient services. So taking away some of those barriers that may make things cost prohibitive is super important when you're in a position to do so in an organization.
Right, and for private practitioners who have their own lactation businesses, just keeping that in mind with your fee structure, making sure that if you are trying to reach that middle population, of which there are a ton of moms, making sure you are affordable.
Or even like a sliding fee, right? So if you normally charge 400 because that is your going rate, do you offer some kind of sliding fee scale for people who may not fall in that range? Like we're all, everyone, this is your business. So if you're private practice, you need to eat. But at the same time, is it possible to kind of be flexible in that based off of the patients you're serving?
Right. I have a website. It's Chocolate Milk. It stands for Chocolate Maternal Infant Lactation Consultation. And one thing, keeping that in mind, what I wanted to do is I made phone calls free, right? But if we set up a virtual visit, that was another fee structure. And then if there was a home visit, there was another fee structure, because many times you can get a lot of problems solved just over the phone, and you don't want a phone call to be a barrier for a woman to be successful with breastfeeding.
And Janelle, from a corporate perspective, how do you all service women that have lactation consultation questions, or do companies do anything to help offset these women in their needs?
No. No. And a lot of the times, like, we'll put resources in the room. So if they're utilized, I don't get feedback. And then a lot of the times it's up to the parents, the mothers, to cut the cost. So I'm not sure if they're utilizing it. Like I said, I haven't gotten any feedback. And once they go in there, I just hope they're using that. I express to them, like, any questions you may have, any feedback for me, please let me know. And so if they're using the resources, I have no idea, unfortunately.
Okay. Well, I have kind of gone through all the questions that I came up with for the panel. So what I wanted to see, are there any participants that have any questions that they would like to specifically direct towards our panel? Each of you all are muted currently, so if you have a question, you would have to unmute yourself.
I have a question. Hey, can you see me? Oh no,
We
sorry.
can hear you, but we can't see you.
Yeah. I've got my breast milk shirt on. Actually, I'm a clinic supervisor for a WIC clinic. And by the way, happy Black Breastfeeding Week this week. We have been in Happy World Breastfeeding Week, so we've definitely been getting all that going this week, giving out lots of freebies. And so somebody mentioned that WIC has a lot of resources, and yes, we do. And we try not to information dump, but just encourage moms to reach out. And we do. So I guess the question for me is that I serve a lot of population with a lot of Black women, and we do, and just referencing back to a lot of young Black women are really excited about breastfeeding, and that's so exciting to see, and it's very true, and I see it all the time in WIC. More and more mothers are wanting to do that, but as a white person counseling Black moms, I haven't gotten very much like negative, weird feedback, like, you know, we're different colors, different faces, I'm not quite comfortable with you, or do you have, and I guess for me, I just want to be able to recognize those barriers. Maybe by nationality, I'm Italian, but so it's a little bit different. But I just want to be able to recognize some of those moms that maybe are uncomfortable but are afraid to say anything, and sometimes I kind of miss the elephant in the room, right? But I really try to pay attention to that. What are some advice that you could give me trying to give education, you know, breastfeeding education? I'm also becoming an IBCLC, so I'm a you know, dietitian by choice, but anyway, so I just are getting there too. So I just, as my journey, I want to be able to make sure that I am not missing anything. Or do you have any advice for me to help me with that?
I'm turning that question over to the panel.
In reference to identifying if there is a barrier, I would say if you notice any hesitation or lack of asking questions, if that communication isn't free flowing both ways, that might signal that they are a little uncomfortable. And I would just address it. One of the big things is to address it head on and say, you know, are you comfortable working with me? We also have lactation consultants that are also available. Would you be comfortable with someone else? And just asking that directly would be helpful, because a lot of times we don't initiate that uncomfortable conversation as the patient.
Okay, that's good advice. Thank you.
I mean, I definitely had a therapist who I was always trying to explain things to. I would say something, and because she was white, if I felt like she didn't understand, I would not stop what I was telling her to go back and try to explain this to her. And at some point, she said to me, like, you don't need to explain it. Like, this is about you. And I was like, but no, I feel this burden that I have to, because I need you to understand the context in order to kind of get what I'm saying. And I feel like as consultants, if you find that extra explanation is going on, people may not feel comfortable to say, like, well, friend, I don't know, I didn't know your name, I'm sorry. They might not outwardly say that to you. So I think just creating, in the event that maybe you're in private practice and there is no other person to refer to in your town because you're in a small town without many consultants, just making sure that you are open with them, you are communicating. There's kind of just creating that space for dialogue where, you know, you can be upfront if you feel like it's comfortable in those crucial conversations. But being mindful, people may not always feel comfortable. So it's, as much as you can, trying to create that safe space and not trying to, you know, there's some statements that you don't want to like try and act like you're down, right? Like you trying to make them feel comfortable in that way, but are trying to make sure that you're just creating a safe space.
Okay, thank you.
Hi, this is Joanne Allen from Chicago, and I just want to say thank you, ladies. I'm a lactation consultant, been a lactation consultant for 26 years and a maternal child nurse. And I became a lactation consultant because I was in charge of a pediatric clinic. And this was during the time of 24-hour discharge. So the mothers would come in and they would be having struggles with lactation, hyperbilirubinemia, babies being readmitted. And I would call the staff lactation consultant to come and see them. And I'm just going to be blunt. If it was a Caucasian, a doctor's wife, somebody of prestige, the lactation consultant was there in 2 minutes. If it was my little sisters, the Medicare patients, sometimes they never showed up. So I'm like, I know what to do. And I became a lactation consultant. So now I'm retiring, so I'm going to refire and try and continue to contribute. But I feel like I can rest now because you guys have taken it on. And I love this organization. I found it on Facebook. So I will definitely be looking at it. And my question is, like, I saw all the resources on your website. So as a lactation consultant, I don't have a website, but I am going to be starting a private practice. Is that an opportunity for me to refer people to your website to get information? Because you look like you've got a lot of things going on there.
So the answer to your question is yes. I mean, that is the point of the website. That's the point of the services. We were founded and originally by a woman in the Bay Area that was a lactation consultant and started seeing that there was a need. She was in education. And so everything that we offer are services that she's determined has been a need over the course of the last 30 years. So the short answer is yes, you can always direct people to our website. So I had 2 people send over questions. The first one is, this comes from Brittany. She says, I'm currently working on a maternal and infant health care project that focuses on reducing racial gaps by 1, addressing racial inequities, and 2, increasing awareness of maternal and child resources. What suggestions would you all provide in how I can increase awareness of breastfeeding resources for African American mothers?
I think it's super important to see who's already doing the work, who's doing the research, who's doing the support groups, and asking them. A lot of times as researchers, practitioners, we are behind the scenes and it's like, oh, I think this would be great for this community. And it's like, no, the community didn't want that. They never asked for this and they're not going to use it. So going to see who are the people, who are the resources, and ask them how they think would be helpful for them as far as getting the word out. And then meeting people where they are. So if you're like, oh, I want people to come to this clinic for this class or for the support group, they don't want to go there. But maybe there's a local church that does groups all the time, and that's a big people respect their opinion, respect what's going on. Do your group there. So meeting people where they are in their community. And just because something may have worked in the Bronx, that doesn't mean that's going to work in Brooklyn. So being mindful of who's doing that work and not stepping on their toes as someone who's coming in to like save the community, like just being mindful of kind of the presentation of that and seeking information and answers from the people in that community.
Okay. So Brittany, I'm going to ask, did that answer your question? And you can feel free to unmute yourself if you want to. Okay. I'm assuming it has answered her question. The next question are, what are your thoughts on home birth versus hospital birth, considering the statistics of women of color not getting the same care in hospitals?
Personally, I didn't have offspring. I have no children. I come to the world of breastfeeding because breast milk is so cool to me. So if I was to have children, it would be in my living room with a midwife and a doula in a tub that I'd put up right in the kitchen or somewhere, because working in a hospital, and I've not had this experience here, but I've seen in other places where care is different for women of color. So for people who are low risk, who would qualify for a home birth, in my opinion, I think it would be great to find a midwife who is qualified and who you feel comfortable with. For people who are high risk, we have a lot of women at Stanford and patients who are extremely high risk or their babies are high risk, then that's where you need to be. So it's a matter of the hospital paying attention to and being really intentional about the care that they're providing. And that's something that we're definitely working on and doing a lot of research around to make sure that we are properly caring for our patients. But I love a good home birth. I think if you qualify and you have a great midwife and a doula and your partner, that's not a bad place to be.
Ultimately, it is the mother's decision, but coming from the nursing standpoint, I would say safety is the priority, right? We want a healthy mom and a healthy baby and a healthy birth. And so regardless of the setting, make sure that all those safety precautions are in place. And if you do choose the home birth, make sure there's a contingency plan should you need to switch to a hospital. And if you are going to the hospital and you expect there to be some poor interaction, make sure you write your questions down, make sure you have an advocate there with you to speak on your behalf if in the case that you are unable to. So in both regards, I would say safety is the top priority.
And I'll just add to that from a personal experience. When I gave birth to my son almost 4 years ago, I actually had him at home, and it wasn't by choice. I kept going to the hospital, letting them know that I was in pain. I was literally thinking I was going to have the baby, and they sent me home 2 days in a row. And then she told me don't come back until my water broke, and then my contractions were 5 minutes apart, which I never felt that I got to that point. My water never broke, and then the contractions weren't that bad. So I was so scared to go back because I thought I was going to be turned around. So I ended up stuck on the stairs and calling my husband and called 911, and 10 minutes later my son was born. But that I would try to do it again at home, but because I am high risk, I do have to go to the hospital. And like she said, safety's first. But that experience that I had was kind of a little traumatic because and then I went to the hospital, and then the lactation nurse didn't support me. So it was like a bad taste in my mouth. So I was like, okay, if I ever had children again, I'm going to do it at home. Well, unfortunately, I can't. But I think if it was me, if I could do it, I would choose to do it at home.
And then Emily says, does anyone have any suggestions for where to find more inclusive teaching tools and pictures? I find it difficult to find breast models, visualizations, and etc. for use in a clinical education setting.
I'm going to push that question back onto the organizations here that provide education and tools. That is something that is missing. It's a gap. And if I was going to ask a corporation to do that, that's what I would ask for, is more diversity in the tools that you're providing, to be mindful of that. As a hospital, I mean, I'm planning a photo shoot. That's what I have control over, to get more pictures, because we need more diversity. But on a larger scale, if more organizations realize that I don't have this is a gap, I implore you to fill that gap.
So Emily, I think the short answer is not sure if the tools are out there, but this is a great platform. We do have partners that we work with in this field, and I definitely can take this question, the need, as well as Zakiya's feedback, and take that to our partners and let them know. I have your email address, so what I'll do is we'll be sure to figure out if there are tools out there, get you that information. If they're not, then we can work with some of our partners to try to get these tools developed. You're welcome.
And Emily, too, the March of Dimes, I don't know if they're active where you live, but the March of Dimes has some good breastfeeding information that shows a good amount of diversity as well. So they might have some tools for you too.
Any other questions?
Hi, it's Leslie from Amita. How are you doing?
Good. How are you?
I'm great. Good to see you all. And I think it's really key. Being from Amita, it's been important, and we are really making sure that we're now doing more marketing in terms of, meeting every, of color or whatever, and having fathers involved in breastfeeding and all different kinds of things. And I think that's so important. And I think once the media helps shift this, everyone will get more comfortable with it. And there are some tools on amita.com if there's anything for Emily. But I 100%, Zakiya, agree with you and the panel. And I love this. I'm also on the WIC conference right now, and happy, breastfeeding week and all this stuff because I think it's so important. So anything I can do to help you all, let me know.
Okay. And then Emily, Liz Stinger also said the educated birth has diverse teaching tools. So I think we're in a place where we're going to wrap up if we don't have any additional questions. If we do, feel free to let me know. Okay, so I really do hope that this was an incredibly informative panel. Wanted to, make sure that everybody had a place to feel safe and have a discussion about, breastfeeding in the Black community, because it's probably been taboo to talk about it, and it's great that we've had a platform to be able to talk about it today. If you have any questions, feel free to send them to info@hh-bc.com.